love it. Love the calls. Plug in the YouTube page. You got to do that. All right, producer Nick, okay, take care of the YouTube page later. Okay, so pizza test question. What does ANOC, if you listen to my commercials, stand for? Every senior out there should have this on their coffee table. ANOC, large pizza waiting for you. 203-757-1320. All right. You know what? We're going to give you plenty of time. We'll give you about 10 minutes, so run around, Google it. I don't care how you get it. Oh, that's impressive. Take it. Go for it. Is that Michael Regan, Medicare and You? How are you?
Hello, Michael. It's Ferris from Fairfield.
The man.
Like the annual notice of change.
Aha! Large pizza coming your way. Kid, you're so smart. It's not even funny.
There's
All right.
no such thing as a bad pizza.
No. we talked about that at like 6 o'clock on Friday night.
All
right.
the main food groups.
Ferris, no last names for HIPAA reasons. Am I allowed to just discuss the question you had for me because it's pertinent that all the listeners out there should know about this?
Oh, I'd love you to,
Okay.
because then by hearing you repeat it, I might, be able to.
Let me
the answer.
give this gentleman a plug. When you're intelligent and you know somebody listens to you, Ferris knows his poop. I mean, he really does. He is so intelligent. It could be a Larry Rifkin show on UFOs hovering Utah, and he's got that down. It could be black boxes going down on planes. I mean, the gentleman's just sharp as a tack. So he reaches out to me, and I do not know why, but boy, the head got big. I'm like, Kristen goes, yeah, the gentleman Ferris is on the phone. I'm like, he is? Okay, so listeners out there, he already won the pizza, so it's over, unfortunately. But annual notice of change is from October 15th through December 7th. So Ferris is nice enough to call me. No names for HIPAA reasons where you work, Ferris. But he gets a letter asking me what this means. And you employers out there, you need to be looking out for this, because if you're the human resources director, you and the carrier are liable to make sure this gets out there. It's what we refer to as the credible coverage letter. My friend Sandy always makes me get the answer and holds my feet to the fire with a follow-up email. Did you get the answer for so-and-so? Annual notice of change brings about change in Medicare plans. What the word credible coverage means is, to Ferris and all my listeners out there, credible coverage means your group employer plan is equal to or better than what Medicare can offer you. So, employers out there, get your people the credible coverage letter. It'll say Anthem, Connecticut, Aetna, United Healthcare. The credible coverage letter is so essential so that you do not get a late penalty. The show is called Medicare and You. This is an educational show. What Ferris doesn't want is, it's none of my business how old you are, but if you're over 65 and you're actively at work, when you get your ANOC credible coverage letter, the credible coverage means you will not receive a penalty for Part D. Credible coverage is always asking you a question on Part D. Ferris out there was nice enough to think I somewhat know what I'm talking about and reached out to me and has some really groovy, like, technical phone that finds you. I had the phone, I call him up and it's like, Michael. And all of a sudden he knows it's me. Anyway, you geniuses probably know VoIP and Skype and all that stuff too. Voice over internet
I'm
protocol.
trying to find an opportunity to argue with you, but
no, don't. So anyway, the Part D for drug coverage. Constituents out there, whether you love her or not, Congresswoman Nancy Johnson had a large part to do with this bill getting passed. January 1st, 2006, it was enacted as law by CMS, Centers for Medicare and Medicaid Services, a Department of Health and Human Services. It stated, if you do not purchase Part D credible coverage, you will receive a 1% per month penalty of the national average, which for a Part D plan is $34.32. So if someone's going along uninsured without credible coverage for 3 or 4 years, that's a 36-month penalty. I have clients out there, unfortunately, that are paying a $19 a month penalty on top of their $37 Part D premium. So, to my friend and colleague Ferris, you got the pizza. I'll send it to you in the mail. I've got your address on the letter you faxed me. It'll go out today. And looking forward to consulting with you in the future. Appreciate your friendship and your time.
Thank you, Mike.
My pleasure.
I assume it'll arrive in 30 days or less.
It'll arrive tomorrow, baby. No worries at all.
Thanks a lot.
All right, my pleasure. All right, caller on line 2. This is Michael Regan, Medicare and You. How can I help you?
Hi, Michael. It's Daryl.
Daryl, first of all, am I allowed to say your name because I'm going to plug it right now? Tell me if it's okay.
Sure.
Okay, I have your card on my desk, which I get my setup here in the morning before the show. Daryl Willenbrock, my friend and colleague. Why don't you inform the people how important it is to know that the ANOC is here and it's upon us. Annual Notice of Change, October 15th through December 7th. Take it away, Western Connecticut Area Agency on Aging.
Okay, we're here again to remind you, just as Michael just said, open enrollment is October 15th, and it will end on December 7th. It's important for you now to start reviewing your plans. Take a look at what you have and make sure it's going to be applicable for next year. Just to let you know, 4 prescription drug plans are leaving the state of Connecticut this year.
Benchmark prescription drug plans.
No, these are HealthNet, CCRX, Medco, and Bravo.
Okay, so Merck Medco's out.
Yep.
Who's going to replace that? Express Scripts?
Express Script Medicare, a new one, Reader's Digest Value RX,
Okay.
and Smart DRX.
Remember, this is good time oldies, Daryl. You're going a little fast. Slow it up here.
Okay, I'll say them again.
All right.
The 3 that are entering are Express Scripts Medicare,
Right.
one we should all remember, Reader's Digest Value RX,
Got it.
and Smart DRX.
Okay.
Okay, and for those of you that are lucky enough to be on the Medicare Savings Plan, which is such a great plan.
And if you're not, you should definitely consider applying. There's nothing wrong with applying.
Absolutely not. And just as an added bonus, there are certain veterans programs that are now becoming exempt.
Right.
Aid and attendance is one that before used to kick people right out of the ballpark.
No, for sure. It's because there's actually so much population now in the Veterans Administration arena.
So that income doesn't count. So again, like Michael said, if you haven't applied, think about it.
Right. It's a simple form. You can either call my staff or call Western Connecticut Area Agency on Aging. Daryl and her staff are incredible. Their number, go ahead, Daryl.
203-757-5449.
And she'll get it right out to you. Or you can make an appointment with one of the Choices counselors, and they can go over it line by line to make sure you feel comfortable. This is something a senior really doesn't want to do at their kitchen table on their own. So, you know, with someone as educated as Daryl or her staff, it's a nice comfort level knowing that they're doing this with a professional.
Plus, you want to go through your drug plan and make sure it's going to meet your needs next year.
Right.
We're noticing that some of the drugs aren't even on the plan yet. So if you're
the
doing
formularies
it on your
is what
own,
Daryl's referring to.
Yeah, if you're doing it on your own on the Medicare.gov site and some of your drugs aren't coming up, that might be a glitch because it's only the start of open enrollment season.
And do you want to touch on the fact that I'd love you to, that the benzodiazepines are going to be included in some formularies next year?
They are.
All right, go ahead. Touch on that.
We are going to have benzodiazepines, which are like Ativan and Valium, drugs such as that will be covered next year on the formularies, and barbiturates will also be covered, provided it's for
a medical necessity.
Well, 3 things specifically: epilepsy, cancer, and chronic mental health disorders. So if you don't fall in one of those categories, it may not be covered or it could be denied.
Okay, so epilepsy, cancer, and chronic health disorders.
Right.
You know what? I hate to say it, and I hate shallow people. They're not all just looking to get high. Some people are depressed. There's widows out there that have lost a spouse. My dad lost my mom after 51 years. These benzodiazepines are essential to just keeping a normal sense of life.
Absolutely. Absolutely.
Yeah, it's not.
And I wouldn't recommend that people don't use them. I mean,
Right.
if something helps
There's
you,
nothing wrong
we
with
always
that.
say
You shouldn't feel embarrassed.
Right. We're lucky we live in an era that we have these drugs.
Right.
Because there was a time when we didn't have anything to help people out, and now we're so lucky with the medical people we have bringing things to life. Excellent.
Awesome. Good phone call. All right, so plug your phone number one more time for my listeners to make sure they contact you.
Okay, it's 203-757-5449.
Excellent. And that's WCAAA, as some people refer you as.
Exactly.
All right, appreciate your time and your friendship.
All right, Michael.
Have a great day, Daryl.
Take care.
Okay.
Bye-bye.
So, obviously you hear, we're on the phone, banging the drum. It's time to go. I have information, and then I'm going to go back to Miles for Smiles because they deserve a little more airtime. But I have information which is so essential. Thanks, Producer Tom. This is something you need to listen to. And if there's only 10 people listening the rest of the show, call your 10. Do the Fabergé effect. You need to realize Anthem Blue Cross Blue Shield has canceled the LPPO, Local Preferred Provider Organization plan. They've canceled it in New Haven County. So all those people that bought at the seminar from Anthem at the Cocoa Keys, and you know who you are out there. Anyway, some of us that have been doing this for 21 years knew it was going to be a one and done. It came out of the gate so great, people. But the funding, the reason you go on a Medicare Advantage is so that the carrier will be 100% liable for the claims. You still have Medicare, but you are essentially giving up Medicare for 80% contribution for the bill. Anthem takes on 100% of the bill. Depending on your age, up to $980 per month would go to the carrier for you enrolling on a Medicare Advantage plan. Well, we knew at the office, if it's zero premium, zero copay for the generic drugs, zero everything, it was unsustainable. So the one and done, it's very sad because Anthem has a fantastic reputation. They'll get their act together. I secretly think they're trying to stockpile money to buy another company, but that'll come out in the wash later. As of October 1st, we are legally allowed to talk about it. Anthem LPPO has canceled. Check your letter. You have gotten a letter. The MetaBlue HMO is now $28 a month instead of $0. Gene and I feel strongly in the following companies. We think United Healthcare is very strong. We as agents are not allowed to say the word best. Nobody's the best. They're strong, and it's all up to your star rating and your claims rate experience. If you pay claims on time, it's very important. And for those of you listening, I am working my butt off to make sure St. Mary's Hospital gets in network. I talked to Bob, the CFO, no last names for HIPAA reasons, and Chad, my friend. Big titles these guys have at St. Mary's Hospital. We are working diligently to get United Healthcare to sign that contract. They have a good plan. Connecticut has a very strong plan. Connecticut did one small thing to shoot themselves in the foot. They raised the out-of-pocket maximum, which I've never heard this term, and I'm not a big fan of it, but they called it MOOP, maximum out-of-pocket. The maximum out-of-pocket was $5,600. It's now gone up with Connecticut to $6,700. United Healthcare did something smart. They lowered the primary care physician to $10, and they lowered the maximum out-of-pocket from $5,600 down to $5,200. Smart move. There's another carrier that has come out of the gate very strong, and it's Aetna. They recovered Aetna, A-E-T-N-A. They had a cease and desist order from the government. CMS shut them down in 2010, carrying over into 2011. So they had to get their act together. They paid some hefty fines, but Aetna is looking strong. I'm not a fan of WellCare, as you know. You shouldn't be selling insurance on the green, but they've got an okay plan if you want to look at that and get bamboozled. But I'm going to turn it over to Miles for Smiles in a few more minutes, so let me plug my seminars, then Miles for Smiles, and then producer Nick is going to plug the last bit so you can see our YouTube page, which is phenomenal. If you haven't Watched it. You have to watch it. But let me give him the fire on that one. All right. We will be doing, G.S. Regan Associates will be doing seminars at the Mattituck Senior Center and at the Cocoa Keys. For the Mattituck Senior Center, the seminars will be 11 to 12 o'clock. They will be on October 17th, October 31st, November 14th, and November 28th. And why am I going slow? So you can write these down. Mattituck Senior Center, 117 South Maid Road. It's basically right near the church, over near Cavallo's Deli, near the new mausoleum funeral home that's being built by some very savvy investors. Good people, too. I never bashed our old mayor. He was a good guy, and he's in with a pretty smart attorney. So it's the 17th, 31st of October, 14th, 28th, and December 5th. I'm almost done, and I'll turn it back over to the ladies. We will be holding our big seminars, which are 50 to 80 people deep, and thank you very much to you listening to me out there. These will be at the Cocoa Keys. We're supposed to say Cocoa Key Water Resort or whatever, but you know where it is. It's right next to Costco. So it'll be at the Cocoa Keys. These will be on October 16th, October 30th, and December 4th. I'm a little pissed that it's not in November, but I'm working on that. I don't know why. Anyway, we'll be holding meetings at the Cocoa Keys, something Main Street. It's near the Costco. You all know where it is. You've been going there for years. On October 16th, 30th, and December 4th. I will push to try to get a November venue. And out there, my seniors are always asking, what's in it for us? As my friend Leo taught me, the with me. What's in it for me? Well, Mary and Katie have hooked up with a local dentist, and they will plug it, that there is actually something in it for you, seniors, by listening to this radio show. Take it away, Katie. Oh, Mary's going to take that little plug.
Take that one, yep.
I saw that point. All right, hit it. What's in it for my listeners?
For listeners today, at Priceless Dental Care in Prospect, that's at the office that Katie and I both work at, Dr. Sakaris has offered to give a 20% discount to any listener of the show to come in for select procedures. With or without insurance, a 20% discount on select procedures. Our phone number to call for that is 203-527-3855. And just mention this show. You'll end up speaking with myself or with Katie to schedule the appointment. Mention the show. We'll be sure to hook you up.
That's the kind of discount I like.
Yes.
See, that's not nickel and dime it. You're not getting a $5 soda out of it. You're getting 20% off your work. Okay, keep talking.
The next thing, Priceless Dental Care has collaborated with us as Miles for Smiles to do a free dental clinic day. Our next day will be Sunday, October 21st, and this day is geared towards those who don't have any insurance. What we'll be doing that day between 9 and 2 o'clock is any adult who comes in pain without insurance, Dr. Sakaris will do what he can to take you out of pain. So again, if you are without dental insurance, Sunday, October 21st at Priceless Dental Care in Prospect. Again, I'll repeat our phone number is 203-527-3855. Also, the point of that day is also to provide free services for children who need their teeth cleaned or preventative care. You can call our number. We can give you some more information about that.
All right.
Now back to Katie has just a few more things for you.
For the seniors, again, we're going to be at the NBC Health Wellness Fair at the Hartford Civic Center March 9th and 10th, and we'll be doing oral cancer screenings for free at our booth.
Nice.
All day for both days. So if you are interested in doing that, you can come see us there, and we'll have information about Miles for Smiles as well.
Okay, so we're going to plug the YouTube page, and then we're going to take a commercial break, and I think that is going to wrap up the show. Producer Tom's telling me. Producer Nick is going to slip in here at Katie's spot and take it away.
Okie doke. Hi, Mike. If you'd like to watch previous episodes or broadcasts of Medicare and You, it's very simple and it's very easy. You just go to www.youtube.com, and then in the little search box, search for Medicare and You, WATR, and you'll be directed to the Medicare and You videos on WATR's YouTube page. Or cut out a bunch of steps and just go to WATR.com, and there's a link to the YouTube page right there on the main site.
Which, by the way, take credit for it. Tell the listeners, you do all the work.
Yeah,
Yes,
when the show is over, I usually go home and capture the footage and then proceed to work on it.
You're talented, bud.
I try.
Right.
Thank you, Mike.
Yeah, you're welcome. Guarantee he will cut that out. I hope he doesn't. Please don't, because producer Nick, this was just an idea, and he's really taken it and run with it. Producer Tom's telling me, Regan, stop talking. We got to plug our commercial sponsors.